Hello, ladies and gentlemen. I hope you're all doing well, and welcome back to another episode in the journey that we're taking towards learning more about African history and the practices of different groups across the African continent. In this episode, we're going to be talking about different medical practices that various African groups engaged in through history. Some of them being medical practices that in some way, shape, or form influenced practices that we observe today in modern Western medicine. This is going to be a very, very good episode. There's going to be a lot of information. So I advise you to maybe get yourself a snack, sit down, and be relaxed. And yeah, I hope you guys enjoy this one. Before I go on, I would just like to mention that this episode is brought to you by Vitilia Botanicals, which basically makes naturally sourced, locally sourced supplements that use locally sourced materials and locally sourced herbs. There'll be more about them as the episode goes forward. Thank you very much to Vitilia Botanicals for sponsoring this episode and making it possible. All right, so the first medical practice that I'm going to be going over that has been recorded to be done in African history is cataract removal. This medical procedure has historically been practiced by indigenous Africans in various parts of Africa, but for today, I'm sort of going to focus on a group of people in Nigeria, where a study was done on a couple of different people that had cataracts removed in the traditional indigenous way that people have done it in the past. The name of the procedure that is performed on people with cataracts is called couching. And this is a procedure that has been recorded as far back as 2700 BC in ancient Egypt. There are certain burial sites that have been excavated where copper needles that are used for the removal of cataracts have been found. And yeah, so this practice goes back in Africa a pretty long time. So what exactly is cataracts? So cataracts is an eye-related ailment that leads to vision loss as a result of the clouding up of the lens that sits in your eye. And it typically occurs in people as they become older, as they age, but it can also happen when you have some sort of a traumatic injury to your eye. The technique of cataract removal, the couching, involves the use of a very fine needle that is pushed into the eye at a certain angle. So it's pushed into the anterior chamber of the limbus and it dislodges the cloudy lens and it pushes it back into the vitreous fluid of the eye. And it removes it from the visual axis of the eye, which enables light to properly enter into the eye and get to your retina so you can see properly. And so this study that was done in 2013 and published in the Ghana Medical Journal on cataracts couching focused on studying a group of people that ranged between the ages of 60 and 90 that had the procedure performed on them in previous years to see how well the procedure worked. So the sample size was about 20 eyes of people. And as I said before, they ranged between 60 and 90 years old. And so the place in Nigeria where the study was done was the Osogbo region, which is in southwestern Nigeria. And vision in the eyes where cataracts couching was performed, vision was maintained and was restored in 25% of the eyes for about 5 to 10 years. And in 20% of the eyes that were studied, vision was restored and maintained for a period between 2 to 5 years. And for about 15% of the eyes that were studied, vision was maintained and restored for a period ranging between 3 months and a year. So in all of the eyes that underwent couching, only about 5% of them had the low visibility maintenance period of a week, which is to say when they had the procedure done and regained vision, it only lasted for about a week. Of all the eyes that were studied, only about 5% reported that happening to them. It's worth mentioning that the group of people that were focused on in this study ranged between the ages of 60 and 90 years old. So to have a result where people who are further along in their age are able to regain vision in the ways that the data presents is quite impressive considering the fact that this is a method of cataracts treatment that's existed for almost 3,000 years now. I would also like to mention that in saying this, I'm not trying to diminish or to dismiss modern medical advancements that have been made and new techniques that exist. This is simply to highlight that when it comes to all of the things that I'm going to mention in this episode, there is a history of us as African people dealing with these ailments and innovating methods to do it effectively. Methods that can be developed upon, methods that can be modernized, methods that can be further developed. That's really the point of me bringing all of these things up. It's to say there's a history that is worth looking into, studying, and then adapting and innovating with modern techniques that exist. So that is cataracts couching. The second medical intervention that I'm going to be mentioning for you guys that I have discovered in my research on this topic is it's a medical intervention that exists to deal with a bone disease. So within the Kisii people of Kenya, around 1985, which is when the study that I'm going to be referencing was written. It was a very, very common thing for the Kisii people to suffer from a type of bone infection called osteomyelitis. So osteomyelitis is a bone infection that occurs when bacteria or fungi infiltrate the bone tissue and the bone marrow, and it basically infects your bone, and it starts creating rotting of the tissue around the bone and rotting of the bone itself. And it's something, again, that was pretty common amongst the Kisii people around the 80s. I don't know if it's still the case today, but it was in the 80s. And the surgical intervention that the Kisii people used to deal with this ailment that was common amongst them was an intervention that is referred to as a sequestrectomy. At least in modern Western terms, that's what it's called. So a sequestrectomy is basically the process of dealing with a bone infection where you make an incision in the area that has the infection. You make an incision in the skin, a sort of lateral incision, and you work your way down to the bone and you cut out all of the infected tissue and some of the infected bone tissue. And the surgical intervention is one that was documented by a man called Dr. David W. Furnas when he was living amongst the Kisii people around the late 70s into the early 80s, studying some of the medical practices that they engaged in. And so he wrote a study that was published in 1986. And in this study, right at the end of it, he makes mention of seeing multiple Kisii tribes people with fully healed or recovering wounds from the medical intervention being performed on them. He makes mention of this in the 1986 paper, and the people that he makes mention of who would engage in the treatment of all of these ailments is a group of people that went by the name Ababari. And Ababari is basically a plural term in the Kisii language that refers to surgeons. Ababari directly translates to surgeons, and then the singular term for Ababari is Omobari. What would happen is the Ababari would have this person present to them with his condition, and they would then make an appointment for a day when they would be dealing with this ailment. And when the day would come, they would sit down with the person who was about to be operated on. They would perform a final assessment to figure out or to pinpoint the area where they were going to be doing the operation. In a lot of cases, they would give the patient that was going to be operated on a little bit of wine to kind of get them slightly intoxicated to lessen the pain. And then they would go on to use tools that they would make themselves and that they would also disinfect using really, really hot water, boiling water. And sometimes they would use the wine as well to disinfect all of these instruments. And then they would perform the procedure. Something that was a quite striking feature of surgical interventions that were performed by the Kisii people is that when they would perform these interventions, they would typically leave the operation wound open. And what they would do is they would, on a regular basis, multiple times a week, within the first 2 months of performing the operation, they would pack it with a mixture of herbs that they would source from the local sort of forest and the local environment. And they would do that on a weekly basis, multiple times a week, for the first 2 months, after which the post-operative care of the wound would then go to the family. And it would be done by the family, but it would still be done under the very, very close supervision of the Ababari themselves. And basically, the reason that they give for doing this is, one, they wanted to avoid necrosis of the wound where the operation had happened, because they were aware of the dangers of necrosis occurring, because it's likely that had occurred in the past with certain Ababari that were performing operations. So they wanted to avoid the necrosis of the wound, and it was much easier for them to use the herbs that they knew had healing properties to ensure that the wound healed properly. When Dr. David W. Furnas was studying all of this and documenting it, it was around the late 70s going into the early 80s, but with all of the people that he had interviewed, the lineage of performing all of these surgeries and the lineage of all of these people and their families that performed these medical interventions goes back a very, very long time. As the episode goes forward, there's going to be a few other things that I reference about some people and their firsthand accounts who are healers, that sort of shed more light on what the lineage of traditional healing amongst the Kisii people in Kenya is. The Kisii people in Kenya are a very, very interesting case study, because there are quite a few medical interventions that they used to engage in, which, when you analyze their history, is most likely something that they developed on their own, independent of any sort of influence. And we'll get more into that as the episode goes by. Yeah, that is the second surgical intervention. So the third surgery that I would like to highlight, that I was very surprised to learn was performed in some parts of Africa, is the C-section. The C-section is something that, again, is documented across multiple different groups in Africa. But for this particular example, I'm going to be focusing on the Baganda people, which is a very sort of close thing, because I have quite a bit of interaction with Baganda people in my personal life, because the person who had my child is a Muganda woman. But this is something, this case, or this account of a C-section being performed, is one that was made in 1878. A C-section is, according to Johns Hopkins, they define a C-section as a surgical delivery of a baby through a cut or incision that is made in the mother's abdomen and uterus. This 1878 account of a C-section that was observed in Uganda was by a man, a British anthropologist, a physician, and an explorer who went by the name Robert Felkin. So Robert Felkin was somebody who had studied medicine in the UK for a while, and then he was sent to Uganda on an expedition, on a missionary expedition, let me say. And while he was there in 1878, he bore witness to a C-section being performed in the Kasese region in Uganda. And while he was there and he observed the C-section, he created a pretty detailed account of how the people in Uganda went about performing the C-section. And so, to make things easier, I'm just going to quote from the paper that he wrote about the C-section being performed. And so the following quotes are from his detailed account, and you can find this detailed account linked in the description box below. I'm going to link all of the papers and all of the books that I used as sources, so you guys can check them out for yourselves. So yeah, this is a quote from Robert Felkin's detailed account of an 1878 C-section being done in Uganda. By 1875, he had become a medical student at Edinburgh University, but before completing his training, he was sent to Uganda in 1878 by the Church Missionary Society. He was presented to King Mutesa, whose personal physician he became in 1879. The operation is performed by men and is sometimes successful. At any rate, one case came under my observation in which both survived. It was performed in 1879 at Kahora. Correction, it wasn't performed in 1878, it was performed in 1879. The patient was a fine, healthy-looking young woman of about 20 years of age. The woman lay upon an inclined bed, the head of which was placed against the side of the hut. A band of mbuga, or bark cloth, fastened her thorax to the bed, another band of cloth fastened down her thighs, and a man held her ankles. Another man standing on her right side steadied her abdomen. He washed his hands and the patient's abdomen, first with banana wine and then with water. He proceeded to make a rapid cut in the middle line, commencing a little above the pubes and ending just below the umbilicus. The whole abdominal wall and part of the uterine wall were severed by this incision, and the liquor amni escaped. A few bleeding points in the abdominal wall were touched with a red-hot iron by an assistant. His assistant held the abdominal walls apart with both hands, and as soon as the uterine wall was divided, he hooked it up also with 2 fingers. The child was next rapidly removed and given to another assistant after the cord had been cut. And then the operator, dropping his knife, seized the contracting uterus with both hands and gave it a squeeze or 2. He then cleared the uterus of clots and the placenta, which had by this time become detached, removing it through the abdominal wound. The red-hot iron was next used to check some further hemorrhage from the abdominal wound, but I noticed that it was very sparingly applied. All this time, the chief surgeon was keeping up firm pressure on the uterus, which he continued to do till it was firmly contracted. No sutures were put into the uterine wall. The assistant who had held the abdominal walls now slipped his hands to each extremity of the wound, and a porous grass mat was placed over the wound and secured there. The bands which fastened the woman down were cut, and she was gently turned to the edge of the bed and then over into the arms of assistants, so that the fluid in the abdominal cavity could drain away onto the floor. The edges of the wound, i.e. the peritoneum, were brought into close apposition. 7 thin iron spikes were polished, like acupressure needles, being used for the purpose, and fastened by string made from bark cloth. A paste prepared by chewing 2 different roots and spitting the pulp into a bowl was then thickly plastered over the wound. A banana leaf warmed over the fire being placed on top of that, and finally a firm bandage of mbugo cloth completed the operation. Until the pins were placed in position, the patient had uttered no cry, and an hour after the operation she appeared to be in quite a comfortable state. Her temperature, as far as I know, never rose above 99.6 degrees Fahrenheit, except on the second night after the operation when it was 101 degrees Fahrenheit, her pulse being 108. The wound was dressed on the 3rd morning, and 1 pin was then removed. 3 more were removed on the 5th day, and the rest on the 6th. At each dressing, fresh pulp was applied, and the little pus which had formed was removed by a sponge formed of pulp. A firm bandage was applied after each dressing. 11 days after the operation, the wound was entirely healed, and the woman seemed quite comfortable. The uterine discharge was healthy. And yeah, that's going to wrap up the quotes that I draw from the detailed account that Dr. Felkin gave about the C-section. I would advise you to look more into this. There's quite a few more accounts that exist of C-sections being done in Uganda, and it's very, very interesting stuff to read about. But yeah, that basically wraps up the account of a C-section being performed in Uganda. All right, guys. So this episode is sponsored by Vitilia Botanicals. This is a local Cape Town natural supplement company that makes all types of really cool stuff like lion's mane tea. They make cancer bush supplements. They make all types of other supplements that are locally sourced and ethically sourced as well. This is very much in the line of holistic traditional medicine that has been passed down to the people who work on these supplements throughout the years, through their own families and through them studying with many different institutions. I personally use these supplements a lot. I really love the lion's mane tea quite a lot. I love their cancer bush supplements quite a lot. And if you guys would like to check them out, There is going to be a link and an email address and a phone number in the description section that you can reach out to if you're in Cape Town and you'd like to try this out, or anywhere in South Africa or Africa really. We can make a plan to get this to you. And yeah, thank you very much to Vitilia for sponsoring this episode. And yeah, please check them out, guys. The fourth medical intervention that I would like to highlight is the craniotomy. The account I'll be focusing on is, again, the Kisii tribe of Kenya. But craniotomies have been documented, again, in many, many parts of Africa. Examples being the Korea people of Tanzania, the Venda people of Nigeria, the Baganda, the Ankole, and the Soga people of Uganda and Congo, and many, many other people. So Johns Hopkins defines a craniotomy as the surgical removal of part of the bone from the skull to expose the brain. That's basically what a craniotomy is. So in the Kisii language, the term that is used to describe a surgeon is omobari, but the term that is used to describe a surgeon who particularly specializes in craniotomies and many, many different types of head surgeries is omobari umutwe. Omobari meaning surgeon and umutwe meaning head. A random side note, the Kisii word for head is umutwe, and the language I grew up speaking, Bemba, the word for umutwe, for head is also umutwe. There's a lot of through lines there, obviously, because all of us are Bantu people. Anyway, these Ababari would perform craniotomy on patients within the community who would be presenting with some sort of discomfort or mental issues stemming from traumatic injuries to the head, or some sort of long-standing issues like migraines and tension headaches and what have you. The surgery would usually be performed at the household of the patient, but sometimes the Omobari had a separate room on their properties that was dedicated to attending to patients' needs. So the following are excerpts from Dr. David W. Furnas's 1986 paper on the traditional medical practices of the Kisii people, the same paper that I referred to earlier in the episode when I was talking about sequestrectomies. The Omobari would discuss indications, risks, and uncertainties with the family preoperative, and a decision would be made after considerable deliberation. The Omobari takes a history from the patient and family members, then examines the patient. As he pallates the skull, he decides the most likely site of injury and plans a corresponding site for the craniotomy. A final examination is made at the time of surgery when the head has been shaved. In acute injury, the goal of the surgery is to identify and remove fracture lines and bone fragments. Loose pieces of bone are removed and any visible fracture lines are smoothed off. One Omobari spoke of the need to remove bad blood when it was encountered. He said if darkness were noted under the dural layer, the thick, dense fibrous membrane that separates the skull from the brain, he would make a small opening and remove blood. Each Omobari made use of freshly prepared leaves, which were ground up in a large wooden mortar just before operation, and these would be packed into the wound for hemostasis. So hemostasis is defined by the National Institute of Health as the mechanism that leads to the cessation of bleeding from a blood vessel. So basically, these herbs would be prepared to pack into the wound to tamp down the bleeding and make it possible for the Omobari to see what he was doing when he would operate on people's skulls. The thick stem of banana leaf was twisted so that the watery sap bathed the wound during surgery to cool the wound, according to the Omobari. Dr. Furnas also hypothesized that the juice served as a sterile irrigation solution. Ghee or fat from the tail of a ram was placed in the wound at the end of the operation. Other herbs were used in dressing changes post-operatively from plants in the nearby forest that were sun-dried and reconstituted with water when needed. In some cases, they were used along with modern medical interventions, like with one Omobari who would bathe the wound with half a vial of penicillin and inject the other half. While complications from the Awabari's medical interventions did occur, according to data compiled by Dr. David Furnas, between 500 and 800 procedures are conducted by the Awabari, and only 3 fatalities were identified by Dr. Furnas and company, putting the mortality between 0.6 and 0.375%. So in a case where traditional Kenyan healers are operating on people's heads in open air without a sterile theater, the fatality rate of those procedures that are being conducted by these traditional healers is less than 1%. That is absolutely amazing. What you see in a lot of these medical interventions in the post-operative care is a level of personalized, hands-on involvement and caretaking by the physician and community that is basically, it's not quite as common in modern day medicine to have your physician, your surgeon be as hands-on for as long a period of time as the Ababari would be when they would operate on a patient. And it's also quite impressive considering the fact that there were a lot of operations that were conducted by these people in a yearly basis, and they would still take the time to attend to all of their patients on a very deep personal level for an extended period of time to see that they were healed. Another important thing is the very detailed knowledge of herbs, plants and roots, and other naturally occurring medical interventions that the Ababari and many other physicians in traditional African medicine absolutely have to know to be able to perform their jobs properly. It's a prerequisite. I don't think it's possible for you to be any sort of effective medical practitioner in traditional African society and communities if you are not deeply involved with going into the bush and learning about all of these things and creating a very symbiotic relationship with the environment that exists around you, which is something that I feel is worth pointing out, because you're sort of starting to see that today, where a few pharmaceutical companies are starting to take a more conscious approach to ensuring that the way they go about producing their medication is symbiotic with the environment and is in line with making sure that wherever they're sourcing their raw materials from, that ecosystem is able to survive. So I would like to read an excerpt from a paper that was published in 2023 by the Cambridge University Press on behalf of the Royal College of Psychiatrists. So this paper was written by a lady who goes by the name of Lydia Kenunto Matoke, who is a Kenyan herbal healer from the Kisii group herself. So she's a banker, or she was a banker, who turned to herbalism based on some personal stuff that she went through in life and experience that she had with herbal healing. She has a PhD in herbology and phototherapy, and she was serving as the president of the Herbal Society of Kenya at the time that she wrote this paper and it was published. Lydia comes from a family of herbal healers, with her grandfather having been an Omobari Umutwe. He was a head surgeon, and her grandmother was a healer who was specialized in herbal interventions for women with gynecological problems. And the following are the excerpts from her paper. My grandmother on my father's side lived in a different village many miles away, but she was very influential for me. She specialized in traditional healing approaches for women with gynecological problems. She would travel to visit me during my primary school years and take me out to pick herbs. My grandmother would hold my hand and walk with me, telling me the names of many plants and how to identify them. She would point out which herbs were helpful for problems, for example, those that were effective for infertility. She taught me which tools to use to gather each herb, the best methods for drying them, and how to pound them into a powder with a wooden mortar. She explained which herbs were best boiled into a concoction and which were better dispensed as a powder. My grandmother often invited me to sit in with her when people came to our house to consult her. Patients would come and she would talk to them and ask them questions. I'd like to also note, with some of these groups, the act of engaging in surgical interventions was a pragmatic one, purely for the purpose of solving a physical ailment that was presented to the person who was engaging in the medical intervention, let me say. And for some of these healers, especially with the Ababari Emitor, there wasn't really any sort of spiritual connotation or subtext to what they were doing. They were simply physicians that were helping heal an ailment. It is also worth noting, though, that within the Kisii tribe, there are traditional healers that tend to lean more on the spiritual aspect of their healing abilities and the spiritual aspect of all of the interventions that they use for the problems that people present to them. On that point, I would like to read another excerpt from Dr. Furnas's paper. And he notes that the Ababari generally were confident that they had been blessed with a gift for their work, but they claimed no supernatural attributes, nor did the operation involve any more ritual than seen in a hospital operating room. Some Ababari would have a moment of prayer before commencing the operation, and others did not. One Omabari said, such things as praying and chanting are for the Abanyamesira, the herbalists who make superficial skin incisions and rub in herbs at suspected sites of disease. Although diviners, purveyors of white magic, and herbalists play an important role in traditional healing in East Africa, the Omabari feels no fraternal attachment to these groups. His concept is that he does a surgical procedure to correct an anatomical problem, end quote. So Dr. Lydia Matoke, who is a Christian herself, had this to say in her 2023 paper. In my upbringing, I was exposed to traditional knowledge as well as Christianity. Even though my grandmother never learned to read or write and therefore couldn't read the Bible, she attended church. She was very clear that as a healer, you have to lead a clean life in order to maintain the power of your healing. She encouraged me to tell the truth. She told me it was important not to get mixed up with crooked people. She was clear that it was important not to exploit people. She also had strong values around protecting patients' privacy and told me all traditional healers have a special consultation room, whether that be a small hut in a compound or an extension of the main house, end quote. So moving on to the final medical intervention that I'm going to be focusing on in today's episode. And this is arguably the most important one because of the contribution that it made to what is referred to by some people as the greatest medical discovery that has ever been made in history as far as the preservation of human life. So in this fourth medical intervention that I'm going to be mentioning, I'm going to be talking about smallpox inoculation. Smallpox is an acute contagious viral disease with boils and fever that is caused by the variola virus. It usually leaves permanent scars with its pustules, and it was effectively eradicated for the most part through vaccination by 1979. The practice of smallpox inoculation has been practiced since time immemorial in many African communities. So record of inoculation against smallpox in Africa goes back as far as the late 17th century, going into the early 18th century. And I have reason to believe, or rather it is believed by many more qualified historians than myself, that practice of smallpox inoculation goes back much further in Africa than the late 17th century going into the early 18th century. And the reason I say that is not only because of beliefs that are held by many historians, but also because of the existence of certain deities that you see in certain African groups. One example of that being Shopono or Obaluaye, who is the master of smallpox and basically the master of all infectious diseases. So Shopono is an Orisha, and an Orisha is a deity in the Yoruba spiritual system. And Shopono is basically the god who brings smallpox. If you make a covenant with him and do not honor that covenant, if you do not worship Shopono properly, he might bring smallpox as well. But at the same time, Shopono is also the same person who can take the smallpox away. And there used to be a very strong sort of society of priests and a group of rituals that would be performed by these priests around the deity of Shopono. And when it comes to the inoculation of people against smallpox within the Yoruba society, the people who are responsible for doing that are the priests of Shopono. And unfortunately, the practice of inoculation against smallpox was eventually stamped out by the British colonial administration of Lagos. The practice of inoculation against smallpox by priests of Shopono was basically outlawed in southwestern Nigeria when the British colonial administration introduced a law that banned, quote, the worship of smallpox in the Witchcraft and Juju Act of 1917. And the way that these priests would go about inoculating people against smallpox is they would make a small incision in someone's arm, and they would either take pus that came from a pustule, a matured smallpox pustule, and rub it in, or they would take scabs, dried scabs from someone who was a victim of smallpox. They would crush them into a powder, and they would rub that into the open wound of somebody. And it would bring on a much milder version of smallpox within the person who was inoculated, which would typically pass, and then that person would be immunized from smallpox for basically the rest of their life. In the stamping out of the practice of inoculation against smallpox by the British colonial administration in 1917, I think it's funny because I have to mention that a year after they stamped out the inoculation of against smallpox by the priests, they themselves introduced a vaccination protocol where they would actually import dried cowpox pus from the UK that they would then use to inoculate people against smallpox, because the practice of using pus from a matured pustule to inoculate somebody against smallpox is a pretty common one, and is one that has been used by pretty much every single group of people since time immemorial. So while on this topic of smallpox inoculation practices within Africa, I believe it's absolutely imperative to make mention of the direct contribution that traditional African smallpox inoculation methods made to the development and widespread adoption of smallpox vaccination in the United States of America. So the first instance of smallpox vaccination being done in America was recorded in 1721 or 1722, I believe, and that was in colonial Boston. And this was an exercise that was spearheaded by a man called Cotton Mather and a physician called Zabdiel Boylston. So Cotton Mather was a very well-known preacher and community leader in colonial Boston at the time. And he was very well read up on diseases and medicine and things of that sort. So around 1714, there was a letter that was written by a certain Dr. Emmanuel Timonius, who had spent time in the Ottoman Empire, and he had come across a treatment of smallpox that the locals were using, where they would make an incision in somebody's skin, they would harvest some pus from a mature pustule of a smallpox patient, and they would rub it in. And again, it would create a milder version of smallpox that would subside within a couple of weeks, and that person would then end up becoming immune from smallpox for the rest of their life. So this letter that Dr. Emmanuel Timonius wrote was then circulated to the Royal Society of Medicine by somebody who was part of that society. And this letter was published by the Royal Society of Medicine, and Cotton Mather managed to get hold of it and read it. And once he got hold of it and read this letter, it triggered a response from Cotton Mather to the Royal Society of Medicine regarding Emmanuel Timonius's account on this type of smallpox inoculation being performed in the Ottoman Empire in Istanbul. And the following that I'm going to read is an excerpt from the letter that Cotton Mather himself wrote to the Royal Society of Medicine regarding Emmanuel Timonius's account on smallpox treatment. I am willing to confirm to you in a favorable opinion of Dr. Timonius's communication, and therefore I do assure you that many months before I met with any intimations of treating the smallpox with the method of inoculation anywhere in Europe, I had from a servant of my own an account of its being practiced in Africa. Inquiring of my Negro man Onesimus, not his real name, by the way, obviously, who is a pretty intelligent fellow, whether he had ever had the smallpox, he answered both yes and no, and then told me that he had undergone an operation which had given him something of the smallpox and would forever preserve him from it, adding that it was often used among the Gormantes, and whoever had the courage to use it was forever free of the fear of contagion. He described the operation to me and showed me in his arm the scar which it had left upon him, and his description of it made it the same that afterwards I found related unto you by your Timonius. So what Mather was basically saying here was that, oh, this is very interesting that I read this account that Mr. Timonius wrote. And a couple of years before I read this account of Mr. Timonius, I had actually heard of this being done in certain parts of Africa by a slave that I own, because Mather owned quite a few slaves. So Onesimus was sold to Cotton Mather around 1707, or rather given to Mather around 1707 by parishioners who had procured him from somewhere before that. And it's worth noting that Onesimus was most likely from the central region of modern-day Ghana, specifically Fort Coromantine in Abanze, in the Abanze region. And this is assumed to be the case by most historians today, because the Coromantese people are a group of people who are actually from Africa and who thrived between 300 BC and 200 CE. And by the time Onesimus would have been born, the Coromantese as a group of people would have ceased to thrive more than 1,000 years before. So it's highly unlikely that Onesimus had originated from where the Coromantese people were. They existed in a region that is now in modern day southern Libya. And furthermore, there isn't much evidence to suggest that there are North African slaves that were taken during the transatlantic slave trade to the Americas. But a large majority of the slaves that were traded in America were traded by the British, and the British got most of their slaves from the West African coast. On top of that, the term that was used to refer to slaves that were taken from Fort Coromantine was Coromantese, which bears a very striking resemblance to the term that Mather used to describe Onesimus. So yeah, it's more likely that Onesimus was actually from the Abanza region in Ghana than he was from southern Libya. After Mather gathered all of this information from Onesimus, he then tried to get people to buy into this procedure within the community of colonial Boston. And people were not very keen on the idea because, obviously, as we all know, there was a lot of prejudice that existed within colonial Bostonians and really most colonial communities in the United States against ideas that originated from Africa and from Asia, which is where the ideas of inoculation against smallpox came from when Cotton Mather suggested that they do this within the community. However, Cotton Mather persisted and he persevered, and along with him, another physician called Zabdiel Boylston bought into the idea, and they decided to try it in 1721. And so they inoculated, using the method that was described to Cotton Mather by his slave Onesimus. They inoculated about 246 people against smallpox. And out of those 246 people, only about 6% died. At the end of 1722, the very same year, when they performed this experiment with the 246 people, it is recorded that about 6,000 people in colonial Boston contracted smallpox. And of those 6,000 people, about 15% died. And so it was based on this data that Cotton Mather collected that the idea of inoculation against smallpox started to gain more legitimacy and more notoriety, and it started to spread throughout the United States. There's also some people who make the claim that this instance of Cotton Mather and Zabdiel Boylston inoculating the 246 people against smallpox was the first clinical trial that ever took place in the history of the United States, and is one of the first instances of medical treatment based on quantitative measurement. So I think it's safe to say that the contribution that Onesimus, whatever his real name was, made to the discovery of this treatment was very, very huge. Because, like I said before, this is the inoculation against smallpox and the eradication of smallpox within the human population at large is known to be one of the most important medical triumphs that has ever been accomplished by human beings for the preservation of human life. And when we look at that purely in the context of the United States, it would not have happened if Onesimus the slave had not been given to Cotton Mather. And it would not have happened if Emmanuel Timonius, the doctor, had not gone to Istanbul in Turkey and observed this being done by West Asian people. That's something that just blows my mind. And in my researching of this topic, I also came to discover that it's a very well-known thing amongst the medical community. You know, you go to the Boston University website, this is a story that you can find there, very well tabulated. There's a lot of literature that's been written about this, and yet there isn't a lot of light that's given to this topic. Actually, in 2022, around the time that the COVID vaccine was kind of being spread all over the world, was the 300-year anniversary for the first time that people in the United States were ever inoculated against smallpox as a result of this information that came from this African slave. So yeah, I just thought that is something that I should add at the end. And yeah, it's really, really cool stuff. If you'd like to look into this, I have a bunch of resources that I've linked in the description, and you can check them out. I've posted all of the stuff with all of the notes that I got from there in the description for you to read if you should so choose. Thank you very much to everybody who's taken the time to check out this episode. I really appreciate your time. Please like, share, and subscribe. If you would like to try out some holistic, naturally sourced, locally sourced supplements, please check out Vitilia. Thank you again to them for sponsoring this episode and for making it possible. Yeah, thank you very much, guys. I hope you have a lovely day or evening further, depending on where you're watching this. And yeah, cheers, guys.